to do well, as long as you just don't put it off until the last minute. Okay. If everybody's good, I'll go ahead and get started here. Did everyone find the slides on the drive okay? Okay, so there's really not a whole lot I can say about a lot of this, but of course everything I have stars by is like stuff that I remember being tagged last year or is a high yield to know for the lecture exam, so pay attention to that. Okay, so you want to know the 4 sinuses, but the way that they are likely to test this is going to be with an X-ray or CT. So over here on the left, what would you call this sinus right here? Right, the frontal sinus. And how about here? Maxillary. And what are these? Anyone? You only got 2 more options left. Take a guess. So I think Dr. K teaches this lecture, so you're going to be ahead of the game. Guess the other one. Yeah, so these are the ethmoidal. These are the ethmoidal air cells. So have you guys heard them called that before? So this is the reason they call them that, because of their appearance. So all this like tiny air cell looking things. These are the ethmoidal sinuses. And then how about back here? What would you call these? Right, the sphenoid. So of the two, you're probably more likely to get this one, just because this is confusing. Like, make sure you realize that the ethmoid sinuses are more anterior or in front of the sphenoid. This is usually the one that you'll see practice questions about, because this over here is easy. And then this is something, I want to say they put this up on the screen during the practical last year, and had one of these tagged. So heads up on that. Okay, so I'm not gonna, just read these to you. So I'm gonna kind of skip through to like some of the tricks that I used last year. Okay, so this right here, they like to ask about a lot. For me, it's easy to confuse which one is condyloid and which one is coronoid. So coronoid, if you think of coronation, meaning crown. If someone's coronated, they have a crown and they're going to go in the front because they're more important. Or you can think, oh, no problem, Brandy. Or you can think, so coronoid as in crown, referring to the crown of the teeth. So this process is going to be closer to the teeth. So hopefully that helps keep these two straight. Okay. A lot of important stuff here. Okay, so last year they tagged this right here on the practical, and they were looking for more than just the zygomatic bone. I added this in the red because this tends to be a point of confusion. So make sure you realize that this is the frontal process of the zygomatic bone because it's closest to the frontal bone. This is the temporal process of the zygomatic bone. And then this back here is the zygomatic process of the temporal bone. So, get those 3 straight in your head and, just be prepared for that in case they tag this because they won't just have zygomatic bone. They'll have something longer like this. And then also another kind of high yield tag, this point right here, what did he call that in lecture today? Right, the terion. And the terion is made up of what? What's contributing to the formation of the terion? So what bone is right here? Frontal, and then here, right, frontal, parietal, temporal, and then if you want to be specific, the greater wing of the sphenoid. So make sure you know that, greater wing of the sphenoid. Okay. I am 99% sure that there's going to be 2 questions from why is that important. Oh, I will explain that just in 1 second. Give me just 1 second. Okay, so right here, you need to know the artery that's running in these grooves in the skull cap. So what artery would be giving off little branches that are making impressions in the skull cap? Right, and the middle meningeal artery. And so, yeah, back to why the terion is important. Okay, so if somebody gets smacked in the head right here, like say you decided to take a baseball bat to someone's head and they get smacked here, injuring the terion is in the proximity of this middle meningeal artery, and that's going to result in what's known as an epidural bleed. So you can see the bleed right here. So an epidural bleed, it's important to know that it's going to occur between what and what. Like the accumulation of the blood is going to be between, right, the dura mater and the skull. Yeah. So epidural is referring to like outside of the dura. Is everyone cool with that? So you're probably going to get more than one question about this. Last year they tagged this indention and asked for the artery. And then also you're going to get a question about an epidural bleed or some type of bleed. And that leads me to this chart right here. So I can't even tell you how many times this has come up in different classes and like how many times you're going to get tested on this. So you really need, and this is kind of like going a step ahead of what you had today, but I think you're getting a lecture from Dr. Chestnut tomorrow. I thought that's what he said. And he's going to go over this. But the way you're going to see it, see if I can zoom in. Okay. So this chart right here is from a book called High Yield Anatomy. And you're going to see these bleeds described in question stems, and they're going to use this stuff here in the clinical features. So the intraparenchymal and extracranial, don't worry about those. The 3 you need to focus on right now are epidural, subdural, and subarachnoid. Okay, so epidural. Have you guys heard of talk and die syndrome? Has that come up at all yet? Somebody says, oh yeah, talk and die. Okay, yeah. Okay, so if somebody was referring to an epidural bleed, something that you'll commonly hear is like, oh, that's, they had talk and die syndrome. That's not like a proper name for it. It's just kind of like I don't know, like a catchy way to remember it. I don't know how else to say it. So if you think talk and die, the reason they say it like this is because if you can imagine, like a common scenario is like they'll talk about a skier who hit a tree and like smacked his head on a tree, and he was fine for a few hours, and then all of a sudden, like boom, he has a brain bleed and dies. Okay, so that's the most common scenario that you're gonna see here. And then subdural, anytime you see a brain bleed associated with either infants or the elderly, they're probably looking for subdural. And this is because, so one common scenario is shaken baby syndrome. So if you shake a baby really hard, of course their head is going to flop back and forth, and that tears the bridging veins inside the skull. So that's going to cause a bleed. And then also, if you have a stem talking about an elderly person falling down, say they were going down the steps outside, they fell down and hit their head, you want to think subdural. And then this last one, subarachnoid. What you'll always hear is the patient comes into the ER and they say, doctor, this is the worst headache of my life. I've never had a headache this bad. Like that is what the scenario always is in board questions. So worst headache of my life, you want to think subarachnoid. So talk and die, babies and elderly, and then worst headache of my life. And every time we've been tested on this, those are the scenarios they use. Basically, yeah. And that's why they call it talk and die. They will seem normal for a while, and then all of a sudden, poop, they're dead. Yeah. And tomorrow, Dr. Chestnut is going to give you the CT images that go along with these three, and they all look different. So you want to be able to associate the image with the type of bleed too. Okay, but yeah, if you know these well, it's going to get you points on points because this always comes back in EPC and MSK and neuro and yeah. Okay, so I wanted to give you a heads up on this one right here. So lambda and bregma, I thought, last year I thought, oh, that's really easy because, lambda, you can associate with the lambdoid suture. And then alphabetical order, bregma's in the front, lambda's in the back. But what they did last year on the practical is they just set out the skull cap. So, you didn't have the bottom half of the skull. You just had the skull cap, and then they tagged one of these. And I remember kind of internally panicking because I was like, oh gosh, I know this, but I'm not sure which side is the front of the head. I know, it's evil, right? I remember being so really in the practical. So make sure you can identify these with just the skull cap. That way you don't panic. But I think if you look for the lambdoid suture, if the skull cap is sitting out, the lambdoid suture is very arched. So you can tell, it just makes it a lot more difficult than if you had the entire skull. So if they do that again, I just gave away their dirty trick. Okay, and then bregma. All right, keep going here. The choanae, so opening of the nasal cavities. Okay. Super high yield, 99% sure this will be a tag. So you need to know that the middle meningeal artery is passing through the foramen spinosum. And so what they'll do on the practical, the way that they test to see if you know what is passing through each of these foramina is they'll feed a pipe cleaner through the foramen, and then they'll say, what structure is passing through the foramen, where you see the red pipe cleaner. So that's why they keep stressing that, you need to try to get all of this osteology down now because they're about to dump a whole lot more information on you because they're going to start talking about, what nerves and what arteries pass through all these structures. So you really want to get down this stuff down first. That way you're prepared for when that comes. All right. So he pointed this out in class, but just to go over it again, the internal carotid artery. So it's traveling through the carotid canal, and then it travels over the foramen lacerum, and it's going to contribute to the formation of the circle of Willis, which you'll get to, which is giving off the blood supply to the brain. So more to come on that. But I know, like, when you're learning the osteology, this is confusing because in some skull models, it makes it look like a foramen, but it's not. It's just a canal. Okay, so to be honest with you guys, we did not learn this last year. I think he added it in. So through the canal over, yeah, right. So through the carotid canal, over the foramen lacerum, and then into the circle of Willis. Yes. Yeah, no problem. So we did not learn this last year. I'm thinking he added it in either to one, just try to make this lecture more interesting, or two, because he's going to test you on it. But I looked for this in first aid, and I didn't see anything on this, but I found this on like a ER boards like website. And the trick they had for remembering this was speak no evil, see no evil, hear no evil. So that's referring to like what is included in these types of fractures. So, speak no evil, you have like the maxillary teeth, and then see no evil is referring to the eyes because the fracture extends up into the orbit, and then hear no evil because now it's extending into the temporal bone. Where you have your internal acoustic meatus and the nerves responsible for hearing. So I thought this was clever. Hopefully that helps. Okay, let's see. Okay, so this one was tagged. So Krista, if you look at the meaning of that word, it means anointed one. So if you think of, the way I remember this is if you think of Christ in the crib, so Christa Galli in the cribiform plate, a lot of people think Christ in his crib. Since this means anointed one, maybe that helps. Okay. Okay. So what I want to say about this slide, all right, very high yield, going to be a question, is what's known as, so this mnemonic is called standing room only, and it refers to the superior orbital fissure, the foramen rotundum, and then the foramen ovale. And you want to know that the ophthalmic nerve, the maxillary nerve, and the mandibular nerve are passing through each of these foramen. And these nerves, and again, this is going a little bit ahead, but yeah, I'm just trying to get you guys, you're going to be ahead of the game, I guess. So each of these nerves are also referred to as V1, V2, and V3. So 1, 2, 3, standing room only. And these are branches of the trigeminal nerve. And you'll hear them called V1, V2, V3. Professor Suzuki, yes. Okay. Yeah, so this mnemonic is awesome. Let's see what else. Okay, so he didn't label this, so I added it in. This is the anterior clinoid process, and then also you have posterior. And so the way this was taught last year was they just said that this was the sella turcica. So if you see hypophyseal fossa or sella turcica, you'll see this called either one. So this is the first time I'd ever seen anyone, and by anyone I mean like any of our faculty, call this that. So if you see other professors use sella turcica to refer to the hypophyseal fossa, um, just realize that it is the same thing. Does that make sense? And I guess what he's getting at is that technically the sella turcica is made up of those four structures, but a lot of times you'll just hear it called sella turcica. And does anyone know what sella turcica means? Right, Turkish saddle. So this looks like a saddle, if that's helpful. Okay. Um, just a clinical, correlate here saying that they're passing through the sphenoid sinus to access the pituitary gland. I don't remember any sort of question about this. It's just to make it more interesting. Okay. All right, so next, this is something that they always do in boot camp. So if you weren't able to make it into boot camp, you're not missing out. So these slides are stolen from two different people, and either of them like explained the story a different way. So whichever way you prefer the story, you can choose. But basically, it goes that so Clivus, he's a Turkish cowboy, and he's gonna ride his horse Sella, which is the Sella Turcica, by the rotunda in the valley. So foramen rotundum and foramen valley. And he's going to look through the optic canals to see his girlfriend, Christa Galli. And Christa Galli is hanging out in her crib, the cribriform plate. And so his silly feet, the superior orbital fissure, are dangling by his side, and he has his trusty lasso, foramen lacerum, on his waist. And then he's going to spit, foramen spinosum, some meat, internal auditory meatus, into a jugular foramen back here. And then he keeps his magnum pistol on the back of his waist. So I mean, yeah, that doesn't really help you remember where they are that much, but I don't know, it's kind of fun. So I wanted to make sure I shared it in case it was helpful. I was looking for a video of somebody walking through this story, and I found this one. And this guy has like a story that's, yeah, he has a story that's totally different, but I thought it was really funny just because it sounded like he was like making it up on the spot. Like some of the stuff he said was just really random. So yeah, if you need a laugh, check out this guy's video. Okay, so the best way to learn this osteology, I mean, you can I would recommend, sitting and staring at your atlas and, trying to point out where everything is. Do that for maybe an hour or two. And then I would start going to websites and taking quizzes on it. I think that's the fastest way to learn it. So, this website right here from Dartmouth, like, I didn't even know this website existed last year, but this is really good. Um, so I would start with this site, and then these two here are pretty good too. But like, wow, this one is amazing for all parts of the practical. So definitely at least check this one out. All right, so let's do a couple practice questions really quickly. All right. So, 40-year-old unconscious man admitted to the ER after being hit in the head with a baseball A CT scan examination reveals a fractured pterion and an epidural hematoma. Branches of which of the following artery are most likely to be injured? Right, E. So boom, you guys got that one. I would be shocked if you don't see it on the exam. Awesome job. Okay. A 25-year-old man involved in an MBA slams his head into a concrete wall of a bridge. His CT reveals the middle meningeal artery has ruptured and the meninges remain intact. Blood leaking from the artery enters which space? Yeah, epidural. Yeah, so just another way that they could ask the same question. But it's for sure going to come up. Okay, so a little throwback here. 27-year-old lands on pine tree. Preganglionic parasympathetic fibers leaving the CNS are lacerated. Which of the following structures contain cell bodies of the damaged nerve fibers? Anybody else want to jump in? Yeah, so the answer here is E. So you want to know that, so sorry, can't spell. Preganglionic parasympathetics. So if I want to be the most specific, and this is kind of teaching ahead a little bit, but do you guys know which cranial nerves are carrying parasympathetic fibers? This is very important to know. You're super close, Professor Suzuki. You just got one wrong. Yeah, 3, 7, 9, and 10. So 3, 7, cranial nerves, 3, 7, 9, and 10. And then where else? Where else do you find preganglionic parasympathetics? Right, S2 to S4. And then preganglionic sympathetics are coming from the intermediolateral cell column of spinal cord levels T1 to L2. Okay, so make sure, I would suggest writing that down. If everyone's got that, I'll keep going. Okay. A 67-year-old woman comes to her physician complaining of visual loss. Her MRI shows an enlarged pituitary gland that lies in the sella turcica, immediately posterior and superior to which of the following structures? And this is the one where I said, don't get tricked. Yeah, so Professor Suzuki, you are correct. So it's the sphenoid bone. So let's go back. I'm pretty sure Dr. K, I don't know if it was on the exam, but he does a concept checked question that's similar to this. So can you see how the ethmoid sinus is located more anterior to the sphenoid? So just keep that in mind. because, I mean, here's the proof. Those are the two that you're most often asked about. All right, well, that's all that I got for you guys tonight. Does anyone have any questions, concerns? Yeah, of course. No problem. All right. Yeah, you're very welcome. Yeah. Yeah, the question or the picture? The pic, yeah. Um, okay. So what is this right here? Right, that's the nose. So more posterior to the nose, you're going to run into the ethmoid air cells. And then behind that is going to be the sphenoid sinuses. And then behind that, you have the sella turcica. Does that make sense? It's just, I mean, that question was just testing relationships. Are those braces? Oh, yeah, I didn't even notice that. It does look like braces. Hmm. Yeah. Uh, did autocorrect get you, Johnny? Do you mean Sella Turcica? Yeah, okay. Let's go back to that picture. Um, hold on. Here we go. Okay, so right here is the Sella Turcica. And if you have a skull model or, definitely look at one, like it's going to look like a saddle. So the Sella Turcica is made up of these four things here. So I think you will hear most of the faculty refer to this entire like scoop here as the Sella Turcica. But Jonathan's just breaking it down into its four different parts. Yeah. So all four of those things make up the Sella Turcica. Any other questions? X-ray image. You want here? It looks like. Oh, this image. Do you want me to go over this one again? So four sinuses: your frontal, maxillary. Oh, in this image, um, I'm not sure. To be totally honest with you, I'm not totally sure what this is right here. I mean, I'm not a radiologist, but the main thing to understand would be that the sella turcica is located immediately posterior to the sphenoid sinuses. So it would be like right back here. Anything else? Definitely, definitely go to these websites and do these quizzes, and you'll get it done a lot faster that way, I think. if you can't be in the lab, of course. All right, anything else? Yeah, you're welcome. You're welcome. You guys are gonna look super smart for Dr. Chestnut tomorrow. All right, well, I'm gonna get off here.